My name is HDarling. I'm Chair of the Elder Law Estate Planning Department at Bacon Wilson. In light of some recent decisions regarding some celebrities, such as Gary Coleman, Farrah Fawcett, there are significant issues that really should be discussed relative to health proxies, powers of attorney, and advance directives. Different states have different rules, different names for different documents. The bottom line is, when you are selecting someone to make these decisions for you, you really should be talking to them now. If someone does not wish to make your end-of-life decisions, we want to know about that now when we're drafting the documents, not later. So it's important to discuss these issues with your family member, friend, physician, anybody who you're naming to serve as the healthcare proxy backup decision maker for you. Normally you would name your spouse first, and then you would name a child. Sometimes you would name multiple children together. That is, if they could agree on making a decision for you, which should be discussed with them. Not necessarily at the dinner table for Father's Day or Christmas, but at some point there should be a very important decision-making meeting where you sit down with your family and discuss what you want and what you don't want. If you don't want to be kept alive by heroic means in the unfortunate event that you're incapacitated and you're not going to get better with quality of life, and you don't want to be kept alive by machines, then it's important to discuss that with your family members now. If, on the other hand, you want to be kept alive, then you should tell them. All of these decisions should be relayed to your attorney when you're deciding these important decisions, and put that information in your estate planning documents, specifically your health proxy. Once that decision is made and the document is signed, we normally suggest that you discuss it with those family members beforehand, and also after the discussion with the attorney and the documents are signed. It gives you an opportunity to provide your physicians with a copy of this document so they also know what you want or what you don't want. They're going to be feeling a lot better about discussing this matter with your family when it comes time to make that decision, if they've already had a discussion with you also and they know what you want and what you don't want. At the same time, it does give your family the option of asking you questions and making sure that they know when it is going to be time to pull the plug in your mind. It's up to the decision maker to carry out your wishes at that time, making the decision, signing the documents that say do not resuscitate, or removing life support. One of the major benefits is that it does not have to go to court, so you're not on the front page, such as a Gary Coleman, Terry Schiavo, Karen Quinlan, Nancy Grazan situation. So it keeps it private, it keeps it out of the court, and some of those cases went on for 6 years, costing people an awful lot of money and emotion and publicity to make that decision. If you have that discussion with your family member ahead of time, they know what you want, they agree to carry out your wishes, the decisions will be forthcoming when the time happens, and it will be a wonderful plan that makes sense for everybody, that makes sure that your decisions are in fact carried out. I'm HDarling, Chair of the Estate Planning Elder Law Department at Bacon Wilson. It's very important that you pay attention to the decisions that you have to make regarding your own future regarding healthcare. Financial issues are important, but the healthcare decisions are very important. They should not be taken lightly, and if we can help in any way in making sure that your wishes are carried out, that your documents are signed, please do not hesitate to give us a call. Thank you.